My name is Dr. Elizabeth Constance, and as a double board-certified OBGYN and reproductive endocrinologist specializing in fertility care, I have dedicated my career to helping families navigate the deeply personal journey of pregnancy, including its many challenges. Today, I stand before you not just as a physician, but as an advocate for comprehensive reproductive health care, which we know is a spectrum. From fertility treatments and IVF, to managing complications such as ectopic pregnancies and fetal anomalies. This spectrum of care is under threat. We've seen firsthand here in Nebraska how quickly rights to abortion can slip away. And many of us are worried that politicians will soon interfere with broader restrictions affecting contraception and IVF, all of which are essential components of reproductive care. In my practice, I have seen patients who have endured multiple cycles of IVF or experienced recurrent pregnancy losses, only to discover a lethal fetal anomaly or other severe pregnancy complication requiring them to seek abortion care. In Nebraska, families usually have their first OB visit around 10 to 12 weeks, while reliable genetic testing and ultrasounds detecting anatomical abnormalities aren't possible until 16 to 20 weeks, at which point any need for abortion services for these health-related issues are already impossible with the existing 12-week ban. The reality is harsh. When complications arise, such as rupture of membranes at 16 weeks, the risks become immense. These situations pose a very high risk of infection and severe maternal health complications, and a very low chance of fetal viability. Yet, under current restrictions, patients are forced to wait until they experience a severe infection, sepsis, or even organ failure before they can receive the necessary care needed to save their life. This risks not only their health, but their future fertility as well. Our training as medical professionals is extensive. We spend decades mastering the nuances of human health to best serve our patients. Yet today we find politicians intruding into our exam rooms, discounting our expertise, and preventing us from predicting and avoiding complications before they become life-threatening. This is why today is so critical. We have made history in Nebraska by submitting a record number of signatures for our initiative to protect the right to reproductive health care, including abortion services. This overwhelming response from Nebraskans sends a clear message. Healthcare decisions should be made by individuals and their doctors, not by politicians. As we move toward the November elections, let us remain vigilant and mobilized. Let's ensure that this moment becomes a turning point for reproductive rights in Nebraska. Our work here is not just about securing a line in our state constitution. It's about protecting lives, preserving futures, and respecting the professional judgment of healthcare providers. Thank you for standing with us today, for believing in the sanctity of personal medical decisions, and for trusting in the expertise of medical professionals. I'd also like to recognize the other doctors standing with us today. Protect Our Rights Soren sponsors, Dr. Robertson and Dr. Doherty. Together, let's continue to fight for a future where everyone can access the care they need, when they need it, without political interference.